Namaste, this is Dr. Vijaya Lakshmi from Vijaya Dental. We have branches at Chikadpalli and Kajaguda. I am having service since experience since 22 years in this dentistry. So today I am going to tell about the replacement of missing tooth. Is it required or not? Is it mandatory or not? So many people will ask me whenever they lose the tooth, does it really require to replace that missing tooth? Yes, of course, 100% I will say, like, it has to be replaced. You can go any of the method you can go, but it has to be replaced. Why? If you observe carefully, like whenever you see a old people or old person with the loss of teeth inside the mouth, you can see these cheeks are going inside. That means this structure is supported with the teeth basically. Whenever they lose the teeth, these cheeks will go inside, which will give the first thing is old age look. There will be a reduced nutrition whenever they can't eat food properly. When the intake is reduced, obviously the physical health will be damaged. So it will go on deteriorating actually. So the basic whatever you have, the eating itself is a major thing, right? Without eating, how the person can survive? No. Drinking water, the person can't survive, right? Maybe 1-2 days and all they can do the dieting and all, but they can't go for the forever. So I tell always, whenever you have a missing teeth, please go to your nearby dentist, go for the replacement of the teeth. Then how it is replaced? There are many methods to replace the missing tooth. The earlier we used to go something called as removable partial dentures. Then we used to go for a cast partial dentures. Then came the fixed partial dentures. I mean, what is the meaning of all these things? The removable, as the name itself indicates, removable partial dentures. I mean, the denture will be removed every day. So they used to keep it in the morning, and before going for the sleep, it has to be removed, kept in the water. That was the one thing. The earlier it used to be there. But people nowadays, they are very, it's not good to remove in front of everybody. So everybody wants to go for the fixed partial denture. So why it's called partial? Suppose if they are having a one tooth missing or the two teeth missing, it's a partial teeth are missing, right? So it's called fixed partial denture. It's called FPD. So it can be many types actually. So in that there are again two methods. We call it called as a bridge or the implant. So what is the meaning of bridge? When suppose one tooth is missing like this, we take support of adjacent tooth, one here, and we'll take support like this, we'll keep the 3 teeth. So when you take it support of the teeth, it's called as bridge. But when the adjacent tooth is in this, the main problem is we are going to grind the adjacent tooth. I mean, we are going to indirectly damage the adjacent tooth. So in that case, people will not agree for that. So then we came is implant. Implant is we take a support of the underneath bone. So in that case, we can place the implant here. I mean, in the bone we can place the implant. So after 3 months, generally in the Vijaya Dental, what we do is we place implant in the bone. We wait for 3 to 4 months. Why waiting? Generally, if you observe any person, whenever they go for this fracture, they give the tying, right? They give the immobilization. So that time they give a rest of 4 to 5 weeks. That means generally the bone formation will take 1 month, like 4 to 5 weeks it will take. In case of implant, we are giving double the time. That is, the implant should sit properly in the bone. We call that as the osseointegration. So once it is implant is firmly fixed in the bone, then after 3 months we will be fixing one abutment. Then we give a crown upon that. And this is the most easiest thing, and which is without damaging any adjacent tooth at all. But all the people, I mean all the persons, everybody, they can't go for the implant. Why? Because it's a bit expensive actually. The material what we are using, the implant itself is a bit expensive, and sometimes they will be, if you are smoking, if they use the hygiene, if they don't maintain well. So I don't prefer at all going for implants. Matlab, like if they are smoking also, I always avoid implant, because if you observe carefully, the person who is smoking will be having the maximum number of, like 90% of the people will be having the bone loss. But implant is depending on the bone. So when there is no bone, we can't go for the implant actually. So in that case, if they give the commitment like, yes, I am going to stop the smoking, if I am going to stop these bad habit like pan chewing or whatever, etc., then we can try at least. Or if the patient is really diabetic, even then also the higher rate of diabetic, then also I advise, like, better don't go. That's the things. So either you can go for implant, you can go for the bridge, but few people, they will be having, all the teeth will be missing. It's called edentulous jaw, like there won't be any teeth in the mouth. So in that case we can go for a complete denture, we can go like a full set of teeth, but that again that has to be removed every day, kept in the water, the morning they have to wear it again. But for some people they don't like it, depending on the profession. So that time what we can do, we can go for a implant. There are many methods of implant, there are many types of implant, like, so then we can go for the fixed teeth in that. So that's it. So whenever you have any missing teeth, please go for the replacement, never ignore. And one more thing I forgot to tell you, if you have a one tooth missing, lower or upper, wherever it is, and slowly gradually the adjacent tooth will start moving, the upper tooth or the opposing tooth will coming down. So that means one missing tooth will cause disturbances in the three teeth, which is not good for the health actually. So never ignore your missing tooth. Generally the people will think like implant is very expensive or the bridge is very expensive. Even this bridge also, there are many types of crowns. We call it as like metal ceramic, or MLS we call it as actually DMLS, or we have a zirconium crowns, depending on the teeth actually. So it's not like only the costliest teeth will be good, never. Depending on the aesthetic purpose, like suppose if the front teeth you are going for replacement, then the better go for the zirconium crown. Why zirconia is better? Because in the metal ceramic there will be metal inside, the covering will be the ceramic. So this margin will be black inside. So whenever they smile, the gum might become black over a period of years. So to avoid that, if the front teeth replacement is there, then go for the zirconium crown, which is better the aesthetic wise. If they want to go for the strength wise, then go for the DMLS. No, if they want to go for the normal teeth, then even metal ceramic also will do it good actually. So depending on your situation, depending on the position, the doctor are going to decide which tooth is suitable for you. So but whatever it may be the thing, but replacement of missing tooth is really a mandatory thing according to my opinion. So never ignore your missing tooth. Thank you everyone.